Hi, good afternoon, and thank you for joining us. My name is Anna Ricklin, and I'm the manager of APA's Planning and Community Health Center, and I'm really excited to host everyone today to feature some of the new resources that we've developed over the past few months in the Planning and Community Health Center through our sponsored programs with some fabulous staff here to share the results of their work and some really great resources for you to be able to advance health in your planning work. I'm happy to see that we've got a lot of people on the line today. We are recording the webinar, so in case you blink and miss an item or want to share a recording with your friends afterward, we will be archiving this on the APA website. We're going to review just a few of the resources that we've developed. I'm going to speak, then Jenny Whitaker and Eliza Norcross will speak. I'll introduce them in a moment. And please, throughout the webinar, you'll see on the right-hand side of the screen a little questions box. You might have to expand it to type into it, but please type in your questions as we go. It's just a 30-minute webinar. We are offering AICP credit, but we are holding some minutes at the end for questions. So we do want to hear from you what you're thinking and if you need any further resources or direction. So the Planning and Community Health Center is one of 3 national centers of planning at APA. We're friends with the Hazards Planning Center and the Green Communities Center. The 3 topic areas that we focus on in the Planning and Community Health Center are active living, encouraging and supporting plans and policies that encourage people to be physically active, food systems, so that is everything related to the healthy food system, and Jenny's going to talk a lot about that, and providing access to healthy food options. And then health in all planning policies. How can we best integrate health perspective into our planning, whether it be at the comprehensive plan level, the zoning code level, development regulations, development review? How can we look at the planning process, every step of the planning process with a health lens, and integrate health-oriented policies into the planning process? Our website there is at the bottom. So the first resource that I want to cover that was released from the Planning and Community Health Center this year was actually a series of resources on health impact assessment. I wish I could see a raise of hands of who knows what health impact assessment is, but a very a short definition is that it is exactly as it sounds, as the name says. It's a methodology to look at how a particular plan, project, or policy in question is going to impact health. So it might be looking at a bridge project. It might be looking at a policy to provide tax credits for affordable housing. It might be looking at a comprehensive plan. So APA did a scan of all of the health impact assessments that relate to planning. We went through multiple databases, talked to our members, and found that about 1/3 of the health impact assessments that have been done in the past decade are on planning topics. So that was really exciting to see. It's about 350 health impact assessments have been done on planning topics in the past decade. And that's the first report. It's an overview of all of the HIAs done in the field of planning, and it's a few case studies as well on specific projects and plans that had HIAs done. So one of the case studies we did in that project was on the Oklahoma City Comprehensive Plan. They did an extensive HIA on their comp plan when it was in draft form, and as a result of doing the HIA, actually integrated more policies related to health into their comp plan, which was really great to see as an outcome, and also a really great process that they went through that aligned with citizen engagement, the use of data, not just planning and built environment data, but also health data to inform how they were shaping that plan. So that's just one example of one of the great things that's in that report. The next thing that we put together with support from the Pew Charitable Trust Health Impact Project, who were our partners on the whole project, was an issue brief. And it's actually just a 6 or 7 page report laying out the benefits of health impact assessment for planning and how it can really help inform and enhance the planning process. And it's written for a general audience, so that means you can pick this up and take it to your decision makers, take it to your planning department directors, take it to your consultants who are helping you work on a new plan or policy, and have them have a greater understanding about the importance of looking at the health impacts before you put a plan or policy, adopt a plan or policy as code. And then the last resource that we developed with this project, which was really cool, is a health impact assessment toolkit. So the first item is kind of just a report about the landscape. The second item is this policy brief for the general audience, and then we have a how-to guide. And the how-to guide is a step-by-step taking you through the screening and scoping stages of HIA. So what are the issues that you want to cover in your health impact assessment? What's your specific question you're trying to answer? And then actual assessment. So what is the methodology for doing assessment? How do you bring together data? How do you assess and analyze that data? And then how do you formulate recommendations as a result of that data to give you guidance on how to act and how to change the plan or policy or project that you're looking at? All of these resources are available at the website above. In particular, I think the toolkit is the most applied resource. It's actually meant to be used in the field as you're doing your planning process. And it includes that guidance and tons of other resources and links to checklists and other kind of applied tools that can help you. The next resource that we developed was was released actually in November. It was an essential info packet on planning and zoning for health and the built environment. This essential info packet offers planners a collection of resources to help them better understand connections between health and the built environment, and also integrate community health considerations into their work, into your work. It's basically an annotated resource that allows you to click through to various websites, APA resources, as well as non-APA resources that are all brought together. So it's just a big encyclopedia of resources that relate to health and planning. And I've just taken an excerpt of this table of contents here. So it's just an image of the table of contents that you would see when you go to the website. And obviously background, clearinghouses, data sources, and then you can see towards the bottom getting into the specifics, looking at example comprehensive plans that integrate health. So if you're building a new comprehensive plan or updating your comprehensive plan, you can go to this resource, look at example policies and goals and metrics that are in other comprehensive plans that specifically address health. The same with an area plan. If you're developing a new area plan and you want to see specific policies that relate to neighborhoods to enhance health, you can see examples there. I think it's a really great resource for that reason, in that it kind of brings everything into one place and provides real-life examples, which is usually the #1 question we get from our members is, can you tell me examples or share examples of how other communities are dealing with this question or this concern? And then drilling down into one of the chapters on zoning, so we actually even address zoning. One of them is a product that we developed here, and there's many more examples from this section on zoning. I just snipped a couple of them here. So we have some background resources, and then actually further down on the page, if you were on the real life page, the link is there at the bottom. You can actually see example zoning codes that integrate health into their code. So a really nice applied resource for all of our members. It's available free at that link, whether you're a member or a non-member. This was supported with funding from the Centers for Disease Control and Prevention, and so all of our resources developed with CDC support are available to everyone for free. And it is also easily updatable, so you can be assured that it is the most up-to-date examples of policies and plans for your edification and hopefully adoption in your own community. So with that, I want to pass it on to our next presenter, Jenny Whitaker, who's a research associate with the Food Systems Planning and Healthy Communities Lab at the University at Buffalo, the State University of New York. She has a master's in urban planning, and her work at the Food Lab assists in building the capacity of Western New York organizations to be successful in creating healthier food systems. She also conducts innovative research on the role of local government policies in facilitating sustainable food systems and healthy communities in rural America. And prior to joining the Food Lab, Jenny served as the Program and Outreach Coordinator for Grassroots Gardens in Buffalo. So she's got all levels of experience in this work. She's currently based in Philadelphia and works on the Growing Food Connections project. Jenny, take it away.
Hi, everyone. Anna, thank you for that introduction. As Anna said, I'm here to talk about one of the larger research and community partnership projects of the Food Systems Planning Lab. It's called Growing Food Connections. I'll be sharing a bit about the background and goals of the project before spending the majority of the time sharing with you resources that have emerged from the project that may be helpful to you. So the Growing Food Connections project is a collaborative work of University at Buffalo, the Ohio State University College of Public Affairs, the American Farmland Trust, Cultivating Healthy Places, and the American Planning Association. So I'm presenting on behalf of the project's 4 principal investigators, which are Dr. Samina Raja, Dr. Jill Clark, Julia Friedgood, and Kimberly Hodgson. And then throughout the duration of this presentation, when I reference we, I'm really referring to the GFC project as a whole. So the broad goal of the project is to enhance food security while ensuring sustainable and economically viable agriculture and food production through local and regional government policy and planning. So within this project is a general research question looking to examine how local government planning and policy improves community food systems. And then the project is integrating research and planning and policy at both the national scale and at the county scale. So at the national scale, we're using a quantitative and spatial analysis, and at the county scale, we're working with sequential research design that's combined with a participatory action research. And that last part, the participatory action research, is where I'm going to focus most of my time today. The broader goals of the project are accomplished within 3 big silos. So GFC is working to further food systems planning through education, through research, and through policy and practice. And in the education realm, the project is training the next generation of food systems leaders through supporting faculty and through supporting students. I'm not going to be touching on that work much today, so if you're interested in the educational support side of the project, you can get in touch with me afterward. The research and the policy and practice portion of the project is tied really tightly together through that participatory action framework. So our primary stakeholder groups are the communities of opportunity and communities of innovation. So communities of innovation are places, we can actually stay on that slide, one back, sorry, are places in the US that have already developed and implemented innovative food systems plans and policies that strengthen the food system. And then the communities of opportunity are places that are committed to moving forward, but are really still in the process of determining how they want to move forward on food systems planning work. So we've investigated what's worked and what's been successful through a lot of interviews with communities that have implemented food policies. And the knowledge that we've gleaned from the communities of innovation helps inform our work with the communities of opportunity. Go ahead and advance the slide, please. So research in the communities of innovation really sought to understand how local governments are strengthening their food system, what exactly it is that explains their success, and what opportunities and barriers they faced along the way. Advance the slide, please. The communities of innovation were identified from a group of almost 300 communities that we started out with and narrowed down to those that appear to be the most innovative and successful. And we conducted about 50 interviews with county stakeholders to really get at and understand the mechanics of the implementation tools that are being used to support food work across the country. Advance one, please. We also have the communities of opportunity. So research within these communities, which is really the participatory-based research, is focused on how policy barriers inhibit connections between low-income consumers and small and medium-sized farmers, and how can increased policy capacity strengthen those linkages, and what opportunities exist for using policy to do that. Advance, please. So the communities of opportunity were identified following a really long process of ranking all of the communities in the United States And then we ultimately selected 8 communities, half of which are urban and half of which are rural, to partner with long-term. So you can see the list on your right. So we're nearing the end of this 5-year-long project. And so for the next few slides, I'm going to focus on the outputs from the research and policy and practice portion of the project. And all of these resources can be found online on our website, growingfoodconnections.com. And then advance the slide, please. And one more, one more. Thank you. So one of the most useful resources we want to share with local governments, particularly in this call, is a searchable policy database. And the database lives online, and it contains a collection of over 100 local government public policies that explicitly support community food systems. It's searchable by geography and policy type, keyword, and location, and it can output a lot of details. Let's go ahead and advance the slide. So it's really useful if, say, your community wants to pass a charter amendment on food and you want to quickly see who else across the country has done this and what language they use to do that. You can click. And if you input what details you're looking for, you receive a list of what communities match your search, and you'll receive details about their policy work and more details about what their community is like. And then most useful, if you click one more, there is the PDF button that you can choose that will bring you to the exact language that the community used for that policy. So it really walks you through an overview of the community all the way down to exactly what language that community used. Advance one more. The Growing Food Connections website also contains a collection of published resources that explore local and regional level public policy relating to community food production and security and the connections between the two. So these listings are especially useful to provide an overview of issues to share with community members or board members or elected officials that are not really well steeped in food systems planning. It's a good broad overview of the lay of the land. One more. If you are interested in, one more, advance the slide.
Yeah, we're checking on the advancing. Oh, here we go.
Thank you. So if you're interested in hearing about what lessons have been translated from those communities of innovation to the communities of opportunity, I recommend checking out a short but really growing series of webinars that have facilitated sharing of information between different communities. So the full videos from those webinars are all archived on the website, and you can expect a new webinar to show up every few months or so. And then if you're looking to learn about each individual community of innovation, there's a series of briefs titled Exploring Stories of Innovation. You can go ahead and advance that slide. And these provide a really in-depth place-based look at how communities are advancing food systems across the country. Advance one more. And then similarly to the Exploring Stories of Innovation, we also have an Exploring Stories of Opportunity series. This is also a place-based series that's exploring where communities start in food systems planning and how they're trying to move forward. And I want to reiterate with all of the stories of innovation and opportunity that all of these place-based briefs cover communities that are really large and small across the country. So if you go in and use them as a resource, you won't just find kind of the usual suspects of big cities or really high resource places. This will cover a wide geography of places. And then the last few that I wanted to mention are the policy and planning briefs. These are a series of briefs that are not place-based, but they're topic-based. And they do include some information from the communities of innovation and opportunity, but they're really focused on topics like food aggregation or food procurement policies. And these go really into the details of how those communities passed different policies. And then the last thing I want to share with you today is the Translating Research for Policy series. This series is in the process of being created, and it's going to focus on translating academic and peer-reviewed research on food systems into short and really easily digestible briefs, and it will include research that comes out of the GFC project, but also research from partners in the project. So thank you everyone for your time. I hope some of those resources are useful to your communities. I really encourage you to visit the GFC website where you can find all of the resources that I discussed and more information about the educational components of the project. We would really love to see these resources be distributed and used. So if you have any questions about how to access them, please let me know. And from here, I'm going to pass it on to the next person that's going to describe some resources available through the Planning for Health project. So, thank you, everyone.
That was great. Thanks, Jenny. Yes, we are moving on, and hopefully the slides match up with the audio. We are moving on to Eliza Norcross, who's a project associate here in the Planning and Community Health Center, working full-time on the Plan for Health project, and has been working with us for a year, working with grantees, and also developing resources for our grantees, and also for the rest of our members. So we're at the point now in the project where we're actually getting some fabulous results that we want to share with the rest of our members, and pass it on to Eliza.
Thank you, Anna. Hi, everyone. Yeah, so as Anna mentioned, we've been working on some new Plan for Health specific resources. One of them being a set of 3 toolkits focused on active living, food systems, and health in all planning policies, which are the main focus areas for the Plan for Health project. So each of the 3 toolkits includes a best practices section, and this is really best practices in the context of Plan for Health. So the 35 coalitions across the country who have been working on planning and health, have really approached that in many different ways, given the context of their communities, and have worked on a range of different initiatives, both at the policy, systems, and environmental change levels. And so the best practices section is really from the Plan for Health perspective. We're not necessarily trying to have these toolkits be the end-all, be-all best practices of, let's say, complete streets, but it's really best practices from within the context of Plan for Health and all of the great lessons learned that the coalitions have accumulated over the course of their project. And so that component especially really includes lessons from partners and resources from our partners, as well as some multimedia. So we have a lot of videos, mini webinars, podcasts, etc. And so those are woven into the toolkits, as well as kind of more drilled down specific resources and other toolkits that the coalitions themselves have developed. So the toolkits are really a compilation of a bunch of different resources with some kind of overall summaries and language about what has been done. And so in addition to kind of these overall content-specific best practices, there's some information about communications work, coalition building, and data collection, with, of course, equity and community engagement a big part of all of those things. So as I mentioned, there's a food systems toolkit, an active living toolkit, and a health in all planning policies toolkit. And this is just a bit of a snapshot of what's included in the food systems toolkit. So in terms of the best practices, we have kind of a grow category, which includes community gardens and home gardens, as well as kind of more on the distribution side, information about lessons learned from Plan for Health coalitions working on mobile markets and healthy corner stores, and then really thinking about how they've made connections across their communities. Each of the toolkits also features one page about kind of an innovative project and kind of deep dives a little bit more into one of the coalition's work. And so The Active Living Toolkit is set up the same way, but with categories around commuting, complete streets, and natural design. And then the Health and Knowledge Planning Policies Toolkit, again, really focuses on plans and policies specific to integrating health into planning. And for all three of these toolkits, they can kind of flow together as one unit. Each of them are about 12 to 15 pages, but they can also, and they're meant to be, pulled apart as necessary. So if someone wanted to get a page about informing their community about distribution best practices, there can be kind of a standalone piece about that we're hopeful is useful as a point of communication and a little bit of information about the Plan for Health work. So in addition to the toolkits, we also have a collection of 53 coalition success stories with more to come early next year. These are all housed on the Plan for Health website. They're 2 pages each, and they include a couple of pictures as well as quotes from the community and basic information about what each of the coalitions have done over the course of their project. And so this includes a little bit of background, challenges, successes, and some of the outcomes that they've been able to achieve. So we encourage you all to check those out. They're great resources for within your community or just as a way to showcase some examples of other work that's happening around the country. And the last thing I wanted to share specific to Plan for Health is also found on our website, which is www.planforhealth.us, and it's the Peer Learning Network. So in addition to the resources we just shared, we also have a lot of other great resources from the coalitions themselves. And so there are a lot of videos, podcasts, mini webinars, and some other resources housed on the Peer Learning Network, and it's really meant as a way to kind of enhance the peer sharing that can occur across the country between different groups working in this space. And we encourage you all to share resources with us if there's something you'd like to include on here. If you are interested in recording a mini webinar or something like that, we would love to continue sharing all of the great work in health and planning that's going on around the country. Thank you, and I'm going to turn it back over to Anna.
Thanks, Elijah. I hope everyone does go check out our website, planforhealth.us. It's full of tons of rich resources as we outline there, and you can find all of our toolkits there. And then, of course, you can also go to planning.org and visit some of our other resources that were presented earlier in the project, in the program, and of course, growingfoodconnections.org to see some of the work coming out of the GFC project. So I have just one question that came in from Richard about HIA, asking how we're working with the American Public Health Association to foster acceptance and advocacy for health impact assessment. We're actually not working with APHA too much on HIA. They are also promoting health impact assessment as a tool, of course, in fields far beyond planning. But we are working very closely with APHA on Plan for Health, and they've been a key partner throughout that project. Our members are working very closely on the ground with APHA members. Public health is obviously a key partner for many reasons, but one of the goals of the Plan for Health project and for many of our projects is to be able to support the unity and the collaborative work between the two professions so that as time goes forward, they will naturally fuse, and some of these policies will just be normal business project work for the public health to be interwoven into planning, and the same for planning to be seen as a public health strategy to improve community and population health. We are just hitting the 1:30 mark, so I appreciate over 100 of you who are on the line today and hearing about some of our new resources. Check out our website, and I hope everyone has a great rest of your day and a wonderful holiday season. Thanks.